Let's get more on this now from Simon Clarke, who joins us from Reading in the United Kingdom. He's a cellular microbiologist. Simon, are you surprised or not surprised by this announcement that the number of deaths in China would actually be so high?
Good afternoon. Well, no, I'm not really that surprised. I wouldn't have wanted to put a number on it, say this time last week, but I knew that the number would be very high because we hear anecdotal evidence that the numbers of infections in China are high. And given their relatively poor vaccine coverage for a number of reasons, one would expect, therefore, that the death numbers would be high.
I know there's been a lot of criticism surrounding China's lack of transparency, basically since the beginning of the pandemic, about the actual case numbers. But does it really make a difference knowing the real death toll and the case numbers from China in terms of how the international community and China can respond?
Well, I mean, it tells you that they've got a problem. That's all, and what the scale of the problem is. But we already knew that. They have been criticised and pilloried for being not very clear with their data, with their numbers. So if people buy this, if they believe that this is indeed the correct figure, then it shows perhaps that China is being more open, if indeed that is the case. But no, I don't think it really makes a huge difference to us, but it shows a certain openness.
We're coming into the Chinese Lunar New Year, which, of course, is a big travel period when people leave the cities and go home to see families that they haven't seen. And for many people, they haven't seen in 3 years now. Are you concerned about the spread of the virus to the rural communities and possibly vulnerable older citizens? And also not to mention where healthcare might not be as sophisticated as we would see in the larger megacities like Shanghai and Beijing?
Yeah, whenever people move, they take viruses with them, and COVID is just one of the viruses that they will transmit. And it sounds like that there's going to be a fair amount of a movement out of the cities into rural areas where people perhaps are less likely to have been vaccinated, where medical care is not going to be so good. So we're very focused in this country and in the West about people bringing it out of China. But it sounds like there's going to be a fair amount of churn within that country too.
China says that there's been a decline in recent days of visits to fever clinics. Do you think cases have peaked in China, and do you think that's significant at all?
Well, if that's the case, then yeah, they clearly have peaked. That's what happens. The numbers go up, the numbers come down, but they don't stay down. You know, at given time, if we're starting to churn the virus through the population in China and into areas where people are more what we call immunologically naive, then we can expect the case numbers, if indeed they get reported, to go back up again pretty quickly.
All right, Simon Clarke joining us from Reading in the UK. Thank you.
You're welcome.